Here is your high-yield review. The etiology and life cycle. Heartworm is caused by the nematode Dirofilaria immitis, transmitted by mosquito vectors. The timeline of the life cycle is heavily tested because it dictates the timing of both preventatives and diagnostic testing. The prepatent period, time from infection to the detection of microfilariae in the blood, is 6 to 7 months. Stage. Location. Key exam facts. L1. Microfilaria. Dog's bloodstream. Ingested by mosquito during a blood meal. L2 to L3. Inside the mosquito. Develops into the infective L3 stage. Requires warm ambient temperatures. L3. Dog's skin. The mosquito deposits L3 on the skin, which enters through the bite wound. L4. Dog's subcutaneous tissue molts within 1 to 12 days. This is the stage macrocyclic lactone preventatives kill. L5. Immature adult, migrating to vessels, reaches the pulmonary arteries by day 70 to 90. Adults, pulmonary arteries, mature and begin reproducing around 6 months post-infection. Pathophysiology. Despite the name heartworm, adults primarily reside in the caudal pulmonary arteries, not the heart itself. The physical presence of the worms and their metabolic waste causes severe endothelial damage. This leads to villus endarteritis, proliferation of the vessel lining. As the vessels narrow and stiffen, pulmonary resistance increases, causing pulmonary hypertension. To push blood through these high-pressure lungs, the right ventricle hypertrophies, eventually leading to right-sided heart failure, cor pulmonale. Take a look at the internal structure of the heart to visualize where this bottleneck occurs. Key insight: Kevall syndrome is an emergency complication where a massive worm burden backs up from the pulmonary arteries into the right ventricle, right atrium, and vena cava. This causes acute tricuspid regurgitation, hemolytic anemia, and cardiovascular collapse. Diagnostics: you must know the difference between the two primary blood tests and what thoracic imaging reveals. 1. Antigen testing, ELISA/SNAP. What it detects: a glycoprotein found in the uterus of adult female worms. Limitations: it will be falsely negative if the infection is exclusively male worms, if the worm burden is extremely low, usually less than 3 females, or if testing is done before the 6-month prepatent period. 2. Microfilaria testing, modified Knott's test or blood smear. What it detects: circulating L1 microfilariae. Differentiation: you must distinguish D. immitis from the harmless Acanthocheilonema recondite, transmitted by fleas. D. immitis microfilariae are stationary and thrash in place, while A. recondite moves progressively forward across the slide. 3. Imaging findings. Radiographs. The hallmark signs are enlarged, tortuous, and blunted peripheral pulmonary arteries. On a ventrodorsal (VD) view, right-sided cardiomegaly often creates a classic reverse D appearance. Echocardiography. Worms appear as hyperechoic parallel lines, often called equal signs, smiley face in the right pulmonary artery and main pulmonary artery. Treatment protocol. The American Heartworm Society, AHS, recommends a staged, multimodal approach. Memorize the roles of the 3 main pharmacological agents used. 1. Macrocyclic lactones, e.g., ivermectin, moxidectin, given to eliminate susceptible migrating larvae, L3 per liter 4, and gradually clear microfilariae. 2. Doxycycline, given for 4 weeks prior to adulticide therapy. It targets Wolbachia pipientis, a symbiotic intracellular bacterium required for the worm's survival and reproduction. Killing Wolbachia weakens the worms and significantly reduces the inflammatory response in the dog's lungs when the worms die. 3. Melarsamine dihydrochloride, the only approved adulticide. It is administered via deep intramuscular injection into the epaxial muscles between L3 and L5. The AHS strongly recommends the 3-dose protocol: 1 injection, wait 1 month, then 2 injections 24 hours apart, as it kills a higher percentage of worms and stages the die-off to reduce complication risks. The golden rule of treatment: strict, absolute exercise restriction is mandatory from the day of diagnosis through 6 to 8 weeks post-treatment. As the large adult worms die, they break apart and are pushed into the distal pulmonary capillary beds. Increased heart rate and blood pressure from exercise dramatically increases the risk of a fatal pulmonary thromboembolism.